you very much. Today I'm going to talk about this subject about electronic nodes based on MEMS sensor for non-invasive detection of colorectal cancer via accelerated profiling. I am Cristhian Duran. I'm an electronic engineer in this university. My university is University of Pamplona. I also coordinator of the multi-sensor system, a pattern recognition research group in this faculty and engineering. The outline of my presentation will be as follows. First, an introduction. I will describe and explain a little bit about the problem statement, some objectives. After that, materials and method that we use in this study. I will describe or discuss some results, the conclusion, and finally the references. First, I need to clarify that this study is a part of the big project. The name is something like that, a combination of different sensory perception system based on electronic nodes, electronic tone, and also we are developing some micro electrodes to put in your skin and to try to detect colorectal cancer detection in Colombian patients. In this case, this is the period of the project. We started last year and we finished in 2027. We had two partners in this study, Ramos University Hospital. In this location, we are collecting the samples. Another institution is the University Rovira i Virgili, is located in Catalonia, Spain. They collaborate with us in order to identify the biomarkers. This is another stage for the project. This is our country. We had in total 32 departments. In this case, my city, the name is Pamplona. We are located, exactly here in this point. Also, we are collecting the samples in Cucuta. The capital. In this case, in this city is located the hospital. We are collecting the samples. You can see here very nice pictures, the views, the landscapes. You are welcome to visit us one day, why not? You can taste delicious food also, the dishes. You can see here my institution. This is the main campus located in Pamplona. The headquarters is located in this city. Also, we had another seat and located in Cucuta, Colombia, is the border with Venezuela. As you can see here, different faculties. Our lab is located in this point exactly. And regarding with my group, we had focused only in perception system, but we had another research line, industrial automation, data analysis, artificial intelligence, health sector. We are applying different prototypes by using, in this case, electronic nodes. This is one, I think the second version of the electronic nodes. This is another version with different electrodes, sensors, with nanoparticulate sensor by using thermal destruction system. This is the new prototype that we will discuss later. The concept of electronic noise, something like that, is compounds with different sensors chambers, also concentration chamber, to try to detect complex odors or simple odors by using pattern recognition methods and also machine learning or different algorithms, different models. We are extract some information from urine, saliva, sweat, but in this case, I explain how we obtain with breath analysis by using MEMS gas sensor. The same is the common concept of electronic nodes, process signal, pattern recognition, and decision making. For problem statement, our motivation, the colorectal cancer is the most common malignant neoplasm in worldwide, ranking third in incidence and second in mortality. In this case, on the other hand, in Colombia, this disease is very concerned. According to the GLOCAN 2022 was the statistical. In this case, this is the third in mortality in both sexes. And this year, there were 640 deaths, recording 9.9% of the cancer deaths in Colombia, only in Colombia. This is the table. I think it's very small. But for instance, in the world, in the 2022, there were 1.5 million of cases. Incidence and also mortality, 720,000 deaths this year, 2022. They had some statistics, but I don't have too much time to explain everything. For the risk factor or CRC, this is the factor that can generate this cancer. Family history, genetic, obesity, cigarettes, being older than 40 years. But some people that had less than 40 years, they had also cancer. High fat, low fiber diets, inflammatory bowel disease, sedentary lifestyle, stress. If you don't practice exercise, maybe you can generate sometimes there are some evidences that the people that are very high fat, they generate cancer. If you have these symptoms such as blood in your stool, modification in bowel partner, abdominal pain, unexplained weight loss, blood hemoglobin count, there are some detection methods such as colonoscopy is very common, is the gold standard in this case, in combination with the biopsies because they extracted a part of the tissue from your colon, and the stool test also, stool DNA, flexible sigmoidoscopy, and colonography. However, there are some alternative methods that we are developing so far. In this case, the idea is to develop microelectrodes, something like that. The electronic nose that we are explained right now, and electronic tone. Sorry, electronic tone. However, also there is another equipment like GCNS, but this equipment is very expensive. But the idea is to compare each other the behavior. There are some objectives. The idea is to try to detect cancer gastric detection, colorectal cancer detection by base with the electronic nose and with MEMS sensors. We have this scheme. The idea is to collect the samples as much as we can. In this case, we are collecting 125 measurements, 27 CRC, and control 35. We are continue working to collect the sample, but it's not easy way to collect because it's very hard to find patients. The second part is the data acquisition, this electronic nose, and the third part is the data analysis. We start information for the MEMS sensor. We apply the feature extraction models. We normalize the data, and we apply, in this case, orthogonal signal correction to avoid noise and also to remove some drift for the blood sensor. And after that, we apply multivariate methods such as PCA, principal component analysis, to discriminate the information. And we obtain the confusion matrix in order to see if the model is good or not. And we extract the metrics for this model. This is the place that we are collecting the samples in the hospital that I mentioned before. The inclusion criteria, we extract some, we collected some patients with biopsies. It was very important inclusion criteria, and exclusion criteria, diagnosis with other cancer were not included in this study. In total, we extract this information, 27 and 35, to do the analysis. You can see here our system. This is the first prototype to try to detect colorectal cancer. We had two main parts, the sample unit, also the sensor chamber. In this case, we developed this special system thinking about the COVID-19. This is a special LED UVC to avoid virus and bacteria also with different sensors. And we designed this special tube with the material stainless steel for medical use, and the material was TPU couplings. For the sensor chamber, we use 14 MEMS sensor. We designed this sensor chamber like a sandwich with medical stainless steel also, with two different PCB boards, and sensor in this part, and digital array in this part. This is the structure of the electronic nose. We printed in this material, PLA, with different sensor, humidity sensor, pressure flow, in order to monitor and control the different parts of the electronic nose. This is the volume, 1 milliliters for the concentration chamber, 10 milliliters for the sensor chamber. This is our team. There are different disciplines here, mechatronics, electronics, this is my former student of mine, this PhD student. This is chemical, doctors, computer of science, students, and so on. The patient were instructed not to eat or drink before the test. We sign the informed consent because it's very important that the people sign the document before the test. We use the electronic nose, the IoT interface. In total, we spend 4 minutes per patient. 4 minutes per patient, this is the times. 2 minutes for stabilization period, 2 minutes for measurement, 1 minute for breath, and also 1 minute for the cleaning. You can see here the prototype with the special software made in Python. And in total, we spent 8 hours and 20 minutes to acquire all the information. As you can see here, the person blowing directly, but it's not, it's forbidden to show the face. You can see here the table with all the sensor. We use 14 layers. In total, we use 7 sensors, 3 digital sensor, analog sensor, 4. In total, we complete 14 layers. For each layer, we had 1 response, and we use also IoT interface in order to record all the samples in real time to monitoring and control the sensor chamber. In this case, we apply different data processing, such as in this case the delta, Gmass, Gmin. We apply this function min-mass scalar to try to normalize the sample, the data. We use OSC in order to remove the drift for the sensor. We apply multivariate data analysis, and also we apply this algorithm. This is our results. We did this radar plot in order to compare CRC and control. We use the sensor because this is ammonia. Ammonia is it is a bug that we can detect when the people had cancer. It's very important. You can see here the different sensitivity for the sensor. In this case, the fingerprint is very different, and you can determine if the electronic nodes is the behavior is okay. And after that, we did the principal component analysis before we filter all the signals, of course. And in this case, we had very good discrimination into
1 minute.
How many minutes? 1 minute. Okay. This is the data classification. We had this table. In this table, we normalize the data. We apply PCA, but the best result was obtained with linear regression by using K-fold 5. For validation method is very important. We obtain 92% with this group of measurements. We had 3 errors in total, misclassified, and 2 errors misclassified. There were overlappings with the CRC, in this case, with control group. But in general, I think we had, with preliminary results, we had good results. There are some metrics, more than 90%. I think it's okay. The sensitivity and selectivity and accuracy reach more than 90%. Our conclusion of this study, as mentioned before, this is our first preliminary results. The result validate feasibility of MEMS electronic node system as a portable, cost-effective, and non-invasive diagnostic tool for CRC detection. And the future work, the idea is to try to increase the number of patients. This thing is not so easy because, you know, there are sometimes the doctor that's very skeptical, and you need to, for approbation, permission, etc. In this case, it's very hard. But anyways, we are trying to do the best. And finally, we compare the result with GCNS in order to validate our electronic nodes. Some references. I want to thank the MinCiencia. MinCiencia is the first entity in our country. They give us some budget, but I know it's not too much, it's not enough. But anyway, we will try to do the best with this budget, only with a few budget for Colombian Potencia de la Vida. Also, I want to thank the IEEE Sensor Letters because they approved our study. Now this study is published in IEEE Sensor Letters. Thank you for this.